Hi, and welcome to my presentation on sexually transmitted infections. My name is Mike Penna, and today we're going to be talking about chlamydia. During this presentation, you'll see that a lot of information that I'm talking about is not actually written on the slides. Please feel free to take notes, and I hope you enjoy this presentation. This presentation has graphic content and may not be suitable for all audiences. So right here we have the picture of what chlamydia actually looks like. It's a sphere, and it's kind of a cool looking little guy. So what is chlamydia? Chlamydia is the most common sexually transmitted infection in the United States. It's the leading cause of infertility in women and men, the leading cause of blindness worldwide, and it's an intracellular organism, meaning that it needs to live inside of another cell. We'll get a little more into the specifics on that in just a minute. And its formal name is Chlamydia trachomatis. Here we talk about a couple of different types of chlamydia. So the Chlamydia trachomatis here in the center, you see that there's the different serotypes. So A, B, and C are typically your conjunctivitis. D through K are typically the ones that produce the lesions, and then L1, 2, and 3 produce the lymphogranulinoma venereum, which is the basically the inflammation at the lymph sites just above the groin. You'll see also, if you look at the top there, that it says that there's the Chlamydia pneumoniae, that is a cousin as well. CDC. In 2014, there were 1,441,789 new cases that were reported to the CDC. So you have to take into account that this is only the ones that actually sought treatment and actually had this reported. Also, from this study, blacks were 6.7 times more likely to have chlamydia than whites, and 2/3 of all cases were between the ages of 14 and 24. So here's a fun little graphic. I'm just going to hover over it for just a moment. Feel free to pause the video if you want to go ahead and read this. It's a cool little koala thing here. How do we get it? There's two basic ways. You can get it from unprotected sex, either vaginally, orally, or anally, or you can get it from an infected mother passing it on to her infant. So who's at risk for chlamydia? The risk group for chlamydia is going to be the same as it is in gonorrhea and syphilis. So women under the age of 25 are always more at risk, women more so than men. And it's always going to be anybody who's sexually active, people who are in the lower socioeconomic status, blacks, Native Americans, and not as much in chlamydia and gonorrhea, but more so in syphilis. You'll see that men having sex with men is also a significant risk factor. So here, again, feel free to pause the video and look at these graphs. They're pretty interesting. This actually shows you the breakdown by ethnicity. This shows you the breakdown by state, so you can see where some of the hotbed areas are down in the south. New Mexico, we talked about the American Indians. Alaska, same thing with the natives there. This shows the breakdown of those who sought treatment, male versus female. This shows the breakdown by county. So again, you can see that hotbed area in the south, a little bit in Southern California, New Mexico, and Alaska. This is an interesting graphic that represents the difference between the men and the women. You can see how women proportionally are much greater at risk than men. All of these numbers from these last few graphics are all from 2010. So this one's from 2012, and it doesn't really change very much. This one shows chlamydia and gonorrhea both as well, but you can see the women are significantly more at risk than men. So how chlamydia works. So chlamydia is a small gram-negative bacteria. It's preferentially infecting epithelial cells. It relies on those cell nutrients. And then within the cell, it's actually going to multiply from binary fission. And then eventually it will rupture from apoptosis, and this leads to the infection process. So we're going to look at this a little more in detail. Okay, so this is the life cycle of chlamydia. So we're going to start over here to the upper left. You see that we start with the elementary body, and this is the actual infectious agent of chlamydia here. This elemental body will infect the cell, and then it will transform into a reticulate body. So basically that just means it's a star shape. That's more indicative of what I showed you at the shape at the beginning of this presentation. It's going to replicate those reticulate bodies within the cell, and then eventually it's going to start transforming those reticulate bodies back down into the elemental bodies. Over time, it will overtake the cell, and then the cell will actually die, or sometimes it can lyse. Apoptosis can take effect if a white blood cell comes along. There's a few different variations on how they make it back out, but the elemental bodies will then make it back out and then continue to infect and cause infection, which then leads to the inflammation, and it leads to all the manifestations of symptoms and things that we're about to look at. So your clinical manifestations, absolutely without a doubt, there are usually no symptoms. Women typically, about 80% of the women, according to a study from 2014, do not report symptoms. The ones I have in bold here are the most prevalent symptoms. So you'll see that pain in general, it could be abdominal pain. Typically it's pain with intercourse and it's pain with urination. Those are very common symptoms if they report symptoms. Another very common symptom is going to be the discharge of pus. It's not going to be very much. It's not going to be anything close to the discharge that you see with gonorrhea, but there will be a discharge. You're going to see possibly bleeding, cervicitis, vaginitis, inflammation of the pelvic structures, so this can lead to pelvic inflammatory disease. There's a risk of ectopic pregnancy. We'll go into a little bit more of that in just a moment. There's a risk of infertility. This is both men and women. Trachoma, which is the conjunctivitis in the eye. This is both men and women. Arthritis, particularly in the knee. And HIV complications really come down to the susceptibility. So if you're already fighting off an infection and you don't have HIV and then you get infected, you're more likely to be infected and at a more rapid rate. And if you already have HIV, this is just going to make things worse because you're already immunocompromised and this bacteria is going to proliferate through your body. So for men, same thing. Usually there are no symptoms, but the absolute number one symptom that's reported for men is dysuria. So that's going to be a painful urination or a difficulty urinating. It's not typically reported as a burning sensation with chlamydia. That is usually more gonorrhea with the burning sensation, because in gonorrhea you typically have the urethritis, which has more inflammation, and so that's where you get that burning sensation from the acidity of the urine passing through the urethra. You have prostatitis, which is if it makes it up into the prostate, you can sometimes have a whitish discharge. It can lead to epididymitis, which is an inflammation. It can reach to the testicles, that same kind of groin area. You can have inflammation, edema, swelling. Trachoma, which is the conjunctivitis in the eye. Arthritis, again in the knees, is the kind of target zone that this ends up at. And then same kind of HIV complications versus men or women, it doesn't really matter. So something to point out here, there's this thing called Reiter syndrome. And so Dr. Reiter basically noticed three classic presentations, if you will, for symptoms. So the way to remember this is can't see, can't pee, and can't climb a tree. Can't see is the conjunctivitis or the trachoma that takes place. Can't pee is the dysuria or the inability or infrequency of being able to urinate. And can't climb a tree is the arthritis. Here's a picture indicating that there may be discharge. Often women do not see the discharge until they find it on their undergarments. This is a really great picture. This really kind of captures what I was talking about the fallopian tube and how the inflammation can cause an ectopic pregnancy. So I'm going to go ahead and I'm going to zoom in here, and you can see where the site of inflammation sets in. And then you can see here where the scar tissue actually forms, and then you see where the egg is actually blocked from coming down the tube, and then you can end up with the ectopic pregnancy. This is what the inside of a vagina looks like. This is the vaginal vault. In the back of the picture here, you have the cervix. Normally, you would see a darkened area in the center. You don't see that because it's covered by the discharge, the whitish purulent discharge right there. So how's chlamydia diagnosed? Chlamydia is tested routinely on mothers. It's tested routinely on people who are immunocompromised, and it's recommended testing routinely for those who are sexually active who are under the age of basically 30. The test is really simple. The gold standard test is the nucleic acid amplified test. This test is going to be used for chlamydia or gonorrhea. It's more specific and it's more sensitive than all of the other tests that are out. So basically, it takes a piece of the DNA from the bacteria. It can be alive or dead, it doesn't matter. And it will amplify this and then test for whether or not it is or is not the offender. These tests can be taken at home or they can be taken in a lab. They're fairly quick. And they've replaced the older test methods of staining on glass or using cultures. The problem with staining on glass was that the organism being intracellular was so hard to see. And then, of course, with the cultures, it just takes a while to grow them. This is a picture of what the test looks like. These are the same tests that can be used in a healthcare setting. These are also, coincidentally, the same tests that are sold for home use. It takes about 15 minutes. You just take the sample, place it in there. Again, on the box, you can see kind of a picture of what chlamydia looks like there. How is chlamydia treated? So chlamydia is treated with antibiotics. Azithromycin is the preferred standard, 1 dose of 1 gram, or you can do a Z-Pak, which would be the 500 milligrams followed by 5 100 milligram increment tablets taken for 5 days. So it's a 6-day regimen. They prefer to do the 1 tablet regimen because there's a problem in America with people not taking their antibiotics all the way to the end of the prescription, and then we end up with resistant strains of bacteria, which is actually starting to become a problem with gonorrhea. You can also take doxycycline, and for pregnant women, they should be treated with azithromycin or erythromycin. Those are safe for them. Penicillin and cephalosporins are not effective against chlamydia. Thank you for paying attention to my presentation. I hope it was informative. I hope you got something out of it. And these are all of my citations. Thank you.